International Society of the Nephrology and Renal Pathology System Classification adopted most recently the National Institute of Health indices to replace the A, C and A/C subclasses of the classification of the lupus nephritis. Now, what is this system? Actually, when we talk about the activity indices, the score is between 0 to 24. The score is between 0 to 24. And how do we calculate the score? We calculate like this. For example, number one, if there is endocapillary hypercellularity, the score will be between 0 to 3. If there is neutrophil oblique karyoraxis, then the score will be 0 to 3. If there is hyaline deposit or wire loop lesions and or hyaline thrombi is there, then there will be the score 0 to 3. If there is fibroid necrosis, the score will be 0 to 3 into 2. If there is, for example, cellular oblique fibrocellular crescents, then the score will be 0 to 3 into 2. If there is interstitial inflammation, the score will be 0 to 3. So, we are discussing the modified and National Institute of Health lupus activity and chronicity scoring system. So, when we talk about the activity index, the total score is the 0 to 24. And how do we calculate it? Number one, endocapillary hypercellularity. Number two, neutrophil oblique karyoraxis. So, endocapillary hypercellularity 0 to 3. Neutrophil oblique karyoraxis 0 to 3. Hyaline deposits 0 to 3. Fibroid necrosis 0 to 3 into 2. Interstitial inflammation 0 to 3. Cellular oblique fibrocellular crescents, then 0 to 3 into 2. So this is basically the activity index. When we talk about the chronicity index, the total score we usually count from 0 to 12. And when we count it from 0 to 12, the first is the glomerulosclerosis, the score between 0 to 3. Fibrous crescents, the score will be 0 to 3. Tubular atrophy will be 0 to 3. Interstitial fibrosis, the score will be 0 to 3. So these are the activity index and chronicity index. Now, if the score is 0 to 5, if we talk about the activity index and the score is 0 to 5, this is called the low activity index. When it is between 6 to 11, this is called the moderate activity index. If score is between 12 to 24, then it is high activity index. In the same way, when we talk about the chronicity index, if it is between 0 to 2, it is low. If it is between 3 to 5, it is moderate. If it is between 6 to 12, it is high. So, in the continuity of the lupus nephritis, we are supposed to discuss the modified National Institute of Health lupus activity and chronicity scoring system. And how do we describe it? Basically what happens, the National Institute of Health lupus nephritis activity and chronicity indices comprises 6 activity scores and 4 chronicity scores. International Society of Nephrology and Renal Pathology System Classification adopted this most recent NIH indices to replace the subclasses like A, C, A/C. Now, when we talk about this scoring system, so scoring system is for the number one activity index and number two is the chronicity index. When we talk about the activity index, the total scoring system is 0 to 24. When we talk about the chronicity index, the total scoring system is 0 to 12. So first we talk about the activity index. Activity index, which is 0 to 12. So we are supposed to C, and we are supposed to give the score according to the findings. And what are these findings? Number one, if there is endocapillary hypercellularity, the score will be 0 to 3. If there is a neutrophil oblique carrier axis, the score will be 0 to 3. If there is febrile necrosis, the score will be 0 to 3. If there is hyaline deposition, for example wire loop lesions or hyaline thrombi, the score will be 0 to 3. If we find the cellular oblique fibrocellular crescents, then the score will be 0 to 3 into 2. And if we find the interstitial inflammation, the score will be 0 to 3. In respect of the fibroid necrosis, the scoring system will be 0 to 3 into 2 also, which we missed previously. So we repeat it. Number one, if there is endocapillary hypercellularity, the score will be 0 to 3. If there is neutrophil oblique carrier axis, the score will be 0 to 3. If there is febrile necrosis, the score will be 0 to 3 into 2. If there is hyaline deposits, wire loop lesions oblique hyaline thrombi, the score will be 0 to 3. If there is cellular oblique fibrocellular crescent, the score will be 0 to 3 into 2. If there is interstitial inflammation, the score will be 0 to 3. So this is the activity index of the National Institute of Health lupus nephritis, lupus activity and chronicity scoring system. Now we come to the chronicity index. If we talk about the chronic index, the scoring system will be 0 to 12. And if there is glomerulus, number one, if there is glomerulosclerosis, the score will be 0 to 3. If there is fibrous crescent, the score will be 0 to 3. If there is tubular atrophy, the score will be 0 to 3. If there is interstitial fibrosis, the score will be 0 to 3. So if we talk about the activity index, if the scoring system is 0 to 5, then the disease is of low activity. If it is 6 to L, this is of moderate. If there is 12 to 24, it is of high. And in chronicity index, if it is 0 to 2, it is low. If it is 3 to 5, it is moderate. And if it is 6 to 12, it is high. So in the continuity of the lupus nephritis, we have discussed the classification, the modified NIH lupus activity and chronicity scoring system. So this system is basically adopted by the International Society of the Nephrology and Renal Pathology system to replace the subclasses like A, C and A/C. Thank you.